With the population of older adults now at 16% and expected to grow to more than 1/4 of all adults by 2060, a new report from the John A. Hartford Foundation and WebMD finds that care of older adults is full of misinformation. Terry Fulmer, president of the John A. Hartford Foundation, joins us this morning to tell us more about this new study. Good morning.
Good morning. Thank you for having me.
So let's talk about this study and kind of what was most surprising to you in it.
Well, in partnership with WebMD, we were able to survey over 2,700 older adults and their caregivers. And what we learned was that they do not know that they can ask for and receive age-friendly health care. And so additionally, we learned that there are these misconceptions. For example, one thing that really floored me was that about 40% of our respondents said that they thought depression was a normal part of aging, and it isn't. So people expect serious functional decline, and our answer to that is you should ask for age-friendly health care.
And explain what that is. What is age-friendly health care?
Age-friendly health care centers around the following three elements, and that is it's evidence-based, so scientifically proven to work, that it causes no harm, and that it is in alignment with the goals and preferences of the older adult and their family, so that you get the care you want in the right place at the right time, and that it is safe. That's really important. We use a moniker called the 4 M's, and that's a set of care processes that center around the following: what matters to the older individual, mentation, medication, and mobility. So we're teaching older adults and we're teaching health systems to use that as a way to really have reliable conversations about care across care settings. And we're really pleased that Florida has been this exemplar state, and Tampa in particular, as we worked on not only age-friendly health systems with Moffitt Cancer Center and Tampa General, but also the University of South Florida doing great work with Trust for America's Health, where that organization is working on age-friendly public health systems because they all need to come into alignment so that we get the right care in the right place.
So what does this mean for people watching this morning, whether you are a senior or maybe you're a caregiver? What are the questions that we need to be asking, or either our current doctors or potential, new doctors that we're seeing? What do you want people to know?
What I want people to know is that they should be asking for age-friendly health care, and that they can help drive the conversation in a way that is in alignment with their goals and preferences, with what matters to them. Also, that they can talk about their medications, any mentation changes they might have, whether that is episodes of forgetfulness that may or may not be meaningful. And finally, mobility, making sure people are as strong and mobile as possible, not just when they're home, but when they're in the hospital. They should be expected to be out of bed and walking so that they keep their function optimal until they get back home.
All right. And then again, what you said earlier, it's not normal. You don't have to be depressed as you age. That's not a normal part of aging. Thank you so much. Where would you send people for more information this morning?
We ask people to use their search engine to look up age-friendly health systems, and that they will be able to find the WebMD website, IHI, the Institute for Healthcare Improvement in Boston, or the John A. Hartford Foundation. So we look forward to having everybody join us.
All right, Terry, thank you so much. We appreciate your time this morning.
Thank you.